Hi, I'm Dr. Dave Novanak of Doctor's Choice Physical Medicine Rehab in Pottsville, Pennsylvania. And today I'd like to talk about hip pain. We see a lot of patients with hip pain, and typically hip pain doesn't exist by itself. Usually there's ankle, hip, or back problems, or rather knee and back problems along with the hip joint. The hip joint is a very movable joint, so a lot of compensations take place there. And what we see is that the hip joint is supposed to be a fairly stable joint, so those muscles around the hip joint really tighten up. So we do a couple screening tests to see if we have a problem like that. Now I have Elaine here with me today because her hip joints are really good. So we're going to show you what normal looks like. So the first thing I'd like you to do, Elaine, is turn your foot in. Now you should be able to do that. If we measure that angle, it should be at least 45 degrees. Now if you could turn your leg out, so that should be a little bit more difficult for you, and that should be about 40 degrees. Okay? And the same thing would be true for the other side. So again, we saw a pretty good internal and external hip rotation with Elaine. Now one of the biggest problems, and one of the most common problems that I see is tight hip flexors, and that involves two muscles. One is the quad muscle in front here, and the other muscle is much deeper. It's your psoas muscle. It's coming from here and all the way through your pelvis and into your back. And this is how we check those out. So if you could kind of lean on your back for me. Okay. So we're going to have Elaine pick this up, and we're going to hold it right here. Okay. So she can get that knee pretty close to her chest, and this is going down. So her deep hip flexors are pretty good. A lot of times you see patients come in, and they're like this when we get them in this position. Those are deep problems that involve their back. And then for this muscle here, we just simply flex that. So she has maybe a little tightness there, but it's not bad. Okay? Overall, Elaine's hip flexors and hip internal and external rotators are pretty good. So if you're having problems with your hip or your knee or your back, this could be the cause of those problems. So if you're interested in getting it checked out more, you can give us a call at Doctor's Choice in Pottsville, Pennsylvania at 570-622-2525. Thank you.